Good morning. My name is Lindsay. I'm the Education Manager for Auctioner Lafayette General, and we're going to be going through the general orientation presentation for contract employees, students, and volunteers. Auctioner Lafayette General owns all of the hospitals in Navy, Auctioner Lafayette General Medical Center, Auctioner Lafayette General Orthopedic Hospital, Auctioner Lafayette General Surgical Hospital, Auctioner Acadia General Hospital, Auctioner University Hospitals and Clinics, Auctioner St. Martin Hospital. We have collaborative agreements with Iberia Medical Center. We are clinically affiliated with Jennings American Legion Hospital in Jennings, Bunkie General Hospital in Bunkie, and Franklin Foundation in Franklin, and Abbeville General Hospital in Abbeville. And then we do have Auctioner Lafayette General clinics throughout our region. The mission at Auctioner Lafayette General is to restore, maintain, and improve health, and our vision is a regional healthcare system that always delivers excellence. Imagine if you were driving around town and you saw a sign for Lafayette General that said, 99% of the time, we send the right baby home with the right parents. So we don't want to be in that small percentage that doesn't send the right baby home with the right family. So we always strive to deliver excellent care to every patient. You are an ambassador of Lafayette General, the Auctioner Lafayette General system while you work here. You're not just a contract employee or a student or a volunteer. You're a part of the team. We don't expect you to be a lone ranger, and we want you to represent Auctioner Lafayette General proudly. We do have our service standards that everyone from our CEO all the way down to our janitors sign every year and on hire. And they go over the different standards that we expect every employee to utilize every day. So in the next few slides, we're going to break it down into each standard and what they represent. So under supportiveness, I will welcome new employees to the system and serve as a mentor when appropriate. Any new hire that we get will have a service badge that they attach to their employee badge. That lets us know that these employees are within their first 90 days of hire. It lets the current staff that are working know that these are new people and to make sure that we spend extra time and offer extra support if needed. And also it allows us to make sure that we're welcoming any new hires into our system. I will be a team player and work collaboratively to help others, including those outside of my department. And I will avoid using the phrase, that's not my job, my patient, or my department. We do understand that there are times where you can't answer these questions, but instead of just saying that's not my job or I don't know, we need to follow it up with, but I will find someone who can help you, or we will get the information you need. So it's okay that you don't know, but we're not going to stop there. We want to help every patient, every visitor, every employee that we can so that they feel that they're getting the support they need. E stands for etiquette. I will use proper phone etiquette by identifying myself and department, followed by a pleasant greeting. Everyone likes to hear a pleasant greeting whenever you're calling, especially to the hospital. It's usually a stressful time. So making sure just to kind of have that smiling face, even though you're over the phone, to make sure that they feel comfortable. I will follow the 10-5 rule, acknowledging the person at 10 feet away with a smile and saying hello at 5 feet. Again, very easy from 10 feet, smile. Even though we're in COVID times right now, even though you have a mask on, if you smile, people can still tell from the way that your eyes look. So still smiling. And then when you get closer to the 5 feet range, acknowledging them, saying hello, good morning, how are you? Anything, little thing like that to let them know that you see them there. I will follow patients, customers, and guests on and off of elevators and through doorways. Again, just another piece of etiquette that we utilize to let those people who are here visiting know that we value them and want to let them go first. I will help lost guests and new employees by escorting them to their destination instead of just pointing. Again, just taking those few extra seconds to actually help them get to their destination instead of saying, oh, you're going to turn right here, you'll take this next left, you're going to follow the hallway down to this. Just gives them a little bit more assistance and helps them feel like you value them. Our R stands for respect. I will dress to reflect respect and professionalism by wearing clothes that are clean, neat, and in good repair. And I will respect dignity and diversity. I will knock before entering patient rooms and cover patients being transported. Vibrancy. I will make a conscious decision to have a positive, willing, and flexible attitude each day. We get that not every day is an easy day, but just trying your best to be a positive person and stay flexible and willing to assist in whatever way we can. I will embrace change by contributing and being open to new ideas and approaches. Further, I will avoid using phrases like, but that's how we've always done it. If the last few years have taught us anything with COVID, is that it's constantly changing. We're constantly having to be innovative in ways that we can improve our care and make sure that we keep everyone safe. So again, we can't rely on that, but that's how we've always done it. We really need to take the time to make sure that we're doing the best practice, safest care for our patients and our visitors. I will promote a nurturing, healing, and safe physical environment by removing clutter, ensuring cleanliness, and keeping equipment in working order. I will report any damaged equipment or unsafe situations immediately. You wouldn't want your house to have clutter. You wouldn't want broken appliances or equipment in your house. So treating this as an extension of your home and taking care of the things that we're using, if they are broken, letting people know so they can be fixed, and keeping it in a clean working environment. The I stands for integrity. I will ensure the privacy and validity of all medical records, correspondence, and confidential conversations. I will proactively seek opportunity for growth and development, and I will accept coaching as part of a supportive culture. We always want to do the best that we can, so utilizing coaching opportunities to identify where we have room for improvement and making sure that we follow through understanding those things and listening and trying to improve our job. I will be fiscally responsible by not wasting hospital time, resources, or equipment. Our cell phones for personal reasons while we're at work unless there's an emergency, making sure that we are making the most of our time at work and not wasting resources. I will act by acknowledging, correcting, and thanking when faced with a complaint or a service recovery opportunity. 3 easy steps to make sure that we are doing our best to recover any service issues. So acknowledge that there was an issue or mistake, following up with them on how we will correct this or fix it for the future, and thanking them for allowing us to do this, thanking them for telling us that there was an issue so that we could acknowledge it and fix it. Communication. So a big one under our communication is our use of AIDIT. We always want to use AIDIT. So your A stands for acknowledge, making eye contact, calling the person by name, smiling, and promptly letting them know that you see them. Introduce, so we always wear our name badges high up on our collars so that people can easily see our name and our position, and then verbalize who you are and what you do. This will promote confidence in OLG. Also, we want to manage up. So tell them how long you've been with the organization, what your role is. If it's like a shift change time, letting the patient and the family know that who the oncoming staff is, how long they've been here, letting them know that they're in good hands so that they start to build that confidence and support from the oncoming staff. Duration. I will provide time frames for follow-up, next steps in service, and update when necessary. So think about when you're at a doctor's office, if they tell you the wait's going to be 2 hours, even though you don't want to wait 2 hours, knowing that up front lets you decide if you need to stay or if you need to leave. Also, if you're told that you need to wait 2 hours and then in an hour they come and get you, that kind of sense of relief you get that you didn't have to wait the whole time. So just being transparent and being truthful with what time frames look like. If things change and it gets pushed back, again, communicating that so that they're aware of it. Explanation. I will actively listen and explain things in a way that people can understand. So the more you talk and explain what you're doing, the more that patients and their families are going to feel comfortable with what's happening. So talking them through your process, telling them what's going to be the next step, and just keeping that communication open. Also being willing to answer questions during that time will help support it. And then thanking. I will recognize, praise, and thank our patients and our team. Thanking them at the end of a 12-hour shift for letting you take care of them. Thanking them for their patience while they were waiting to have to get blood work or waiting in the ED or the urgent care. Thanking our team if we had a busy day and everyone just kind of worked together and supported each other. Never forget to thank your team as well. So the thanks can come in many different ways. A few other things, I will take the time to read hospital and system communication, emails, flyers, newsletters, policies, electronic boards, and etc. to stay informed of responsibilities, changes, and events, and I will avoid repeatedly using the phrase, I didn't know. I will avoid using cell phones, internet, wireless technology, etc. for personal reasons during work hours. And our last E stands for excellence. I will convey concern and compassion as well as a willingness to serve always. Above all, I will exceed the expectations of my customers, patients, and coworkers by consistently doing the right thing at the right time for the right reason. I agree to abide by the preceding standards of behavior for the duration of my career here. So this is what we sign as new hires. You sign before you started, and you'll sign this annually as a recommitment to making sure that you follow these service standards every day. So the next section we're going to talk about is HIPAA and confidentiality. So HIPAA stands for Health Insurance Portability and Accountability Act of 1996. Port stands for portability. So like a ship in a port, when a person gives a doctor's office or a hospital their personal health information, the export of that information and the doctor's office or hospital imports it. So the HIPAA's purpose is to regulate how information is shared, when, and with whom. Accountable or accountability, a physician, nurse, information desk attendant, housekeeper, volunteer, student, or etc. is accountable and responsible for their use of someone's private health information. We must only share this with whom the patient has given permission or that have direct care of the patient. So we really need to be mindful that if they aren't, a staff member is not involved in the patient's care, we really need to make sure that we're not sharing that information. It's on a need-to-know basis. So if they don't need to know, we need to make sure that we're keeping it between the people who need it. HIPAA confidentiality in you. You may or may not have access to a patient's chart, but we must preserve family and patient privacy by refraining from questioning staff, patients, family, or visitors about patient diagnosis. Do not ask, so what's wrong? Or what do you have out of curiosity? Do not give medical advice, but refer all medical questions to the appropriate staff promptly. And you may ask an appropriate question such as, how are you today? Anything that you see here or anything else needs to stay within our facility. And a general rule of thumb is, do you need to know to do your job? And if not, then we would want you to avoid the information. Even information about a close friend, family member, coworker, fellow student, not learned from the patient themselves, but found out while on duty is considered confidential information. We have had students and employees termed because of this. So this is something that is very, very critical that you follow. Our next section, we're going to speak about infection prevention. What is the one most effective way to prevent infections? We've heard so much about it over the last year or so, hand hygiene. Hand washing regularly, or when you notice that it's become soiled, is the easiest way to prevent infection. So following the guidelines, making sure that you're washing your hands for at least 20 seconds. And then as you can see on the screen, making sure that you get the all areas. So on the right-hand side, the areas in red are the most frequently missed areas during hand hygiene. So making sure you get your fingertips, your fingernails, the crevices in between your fingers, and definitely your thumbs as well. Don't forget up close to your wrists as well. Easy way to prevent the spread of infection. We must wash our hands before and after entering patient rooms. You must wash with soap and water when hands are visibly dirty or soiled, after using the restroom, or when having touched blood or other bodily fluids. We must wash hands even if you are planning on wearing gloves. So just because you think that you're being safe with that, we're still required to wash our hands in between. If for some reason you don't have quick access to washing your hands, we can utilize our alcohol dispensing areas as well, but you still need to make sure that you're washing your hands regularly. So the best time, or the most important times to wash our hands, is whenever you touch someone, you pick up germs, When you touch something, you can pick up germs, or whenever you cough or sneeze, you can still transmit germs. The CDC reports that 1.7 million people get a healthcare-acquired infection each year. These healthcare-acquired infections result in 99,000 deaths every year, which is 271 deaths each day. For our masks, this started back in July of 2020, but no cloth masks. Cloth masks are allowed, but without print, slogan, or embellishment. The exception would be any UL, LSU, or Saints affiliates. Since they are an affiliate, we can wear those masks that have that information on them. However, if you will be in a patient care area, you must wear a hospital-grade level 1 mask or N95 if you're in a COVID patient care area. Any masks that contain valves must be covered. The external valves are not sufficient and do not provide a source control for COVID-19. So any face masks with exhaust valves do not prevent aerolization and can discharge virus droplets out in highly concentrated quantities. So you must either wear another mask over it, but we really encourage you to avoid the masks with the valves. Our next section, we're going to speak about facility alerts. This came out last year in regards to the changes. So instead of hearing codes, you're going to hear either facility alert, security alert, or medical alert. And we'll get into some specifics in the next few slides. So for facility alerts, some examples would be employees needing to check their email or downtime. And so the way that it would be announced overhead would be attention, attention, facility alert, employees please check email notification. Facility alert, computer downtime, all employees and physicians please begin downtime procedures. Or facility alert, weather alert. The National Weather Service has issued a severe weather alert for this area. It will then be followed by the instructions on the type of weather alert and what precautions need to be taken. A few other facility alerts would be facility alert chemical spill. They would specify the location and to please avoid the area. And they would also request that the decon team please respond. Facility alert emergency department at capacity. Employees please activate response plan. Or facility alert fire alarm received. They'll specify the location. Please avoid the area. Fire team please respond. If there were to be a fire alert, just a few acronyms to remember. RACE. So RACE would be you want to remove anyone in immediate danger and maintain calm. Activate by pulling the alarms and be aware of your surroundings. Know where the alarm pools are as well as your extinguishers. Contain and clear, close windows and doorways, clear the hallway. If you do have fire doors, making sure those are closed as well. And then evacuate the area. Leave the area if directed to do so. And then also remember, if you are having to extinguish a fire, remember the PASS acronym. So you're going to pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side. Next, we're going to speak about some of the security alerts. So again, they'll come overhead and say attention, attention, followed by the appropriate security alert. So security alert, threat received, employee please begin floor to ceiling search. Notify, they're going to specify who you need to contact for any suspicious packages. All employees, patients, and visitors at this time turn off all wireless communication, including cell phones, wireless telephones, beepers, and two-way radios. Security alert, missing child, which would be followed by a description of the child. Please notify who you would need to call, their extension if you see the child. Security alert, security assistance needed. They're going to specify the location and say visitors, please avoid this area. Security alert, armed intruder, their location. Avoid this area. Employees, please take appropriate action. Security alert, missing person, description of the person, who to notify, how to call them, and if you see this person. Please note that this alert is only intended for at-risk patients, such as patients with dementia, traumatic brain injury, or confusion. This should not be used for patients with normal mental status who decide to leave their unit. And then our medical alerts. Again, it's going to start by saying attention, attention, followed by your medical alert. So medical emergency, location, it's going to give either the unit or the room number, code team, please respond. Medical alert, stroke protocol, the location, again, the unit and or the room number, stroke team, please respond. Medical alert, LVO, or large vessel occlusion protocol, the location, stroke team, please respond. Medical alert, STEMI, again, the location, STEMI team, please respond. Medical alert, trauma level, and it's going to specify which level, the ETA in minutes until they arrive, trauma team, please respond. Medical alert, mass casualty with hazardous chemical, activate mass casualty plan. Medical alert, infant delivery, the location, please avoid this area, delivery team, please respond. The next few slides, we're going to talk about door signage. We do have systemized door signs throughout our organization. So the first one is our contact precautions. So all of your orange contact precaution signs are going to show that the visitors must check in at the nurse's station before entering the room, strict hand washing, gloves and gown upon entry, and doors remain closed at all times. On this one, in the bottom right corner, you see the little black triangle, which represents a C. diff. So for that one, we need to make sure that our hand hygiene includes soap and water. Protective environment precautions. These would have been our previous neutropenic precautions. So visitors must check in at the nurse's station prior to entering the room. Strict hand hygiene before and after patient contact. No sick visitors or personnel because they are neutropenic, immunocompromised, and no live plants. The reason being that dirt could have organisms that could cause the patient to get sick. Droplet precautions, again, visitors, please check in at nurse's station before entering. Face and eye protection required, and door must remain closed. Your airborne precautions, again, visitors must check in at the nurse's station. An N95 is required to enter the room. These patients need to be in a negative pressure room, and the door must remain closed at all times. In the middle, we have our red NPO sign, which lets the staff and visitors know that means nothing by mouth, so that patient can't have anything to eat or drink. And then our yellow star is our falling star sign. So anytime we see this on a patient door, it lets us know that these patients are fall risks. So we want to make sure when we go into the room that the walkways are free of clutter. If we're getting ready to leave the room, that they have everything they may need within reaching distance, so they're not trying to get up and grab anything. And we want to make sure that while we're in the room that we're rounding meaningfully. So if offering for the patient to get up and go to the bathroom, asking if the patient needs to be assisted to get up to a chair, anything like that to avoid them trying to get up by themselves when they're alone in the room. A few other door signs to consider specific to the maternal newborn area. If any of the following signs are seen, it may mean infant loss, adoption, or other specific situations where it would not be appropriate to congratulate the patient and family on the birth of a baby, such as in the case of an infant death. It is best practice to simply do your AIDIT and complete your task or procedure that you have come to the room for, and refrain from making any comments regarding a baby if you are not certain of the circumstances in which we must remain HIPAA compliant. So the first sign is the fall and leave sign, which we actually utilize throughout the facility. So if you see this in the mother baby or the labor and delivery areas, it typically means that there's been an infant death. So we want to make sure to avoid "how is your baby" or any similar remarks to that. If you do go into the room and you notice that there is a crib with an infant in it, that may mean that the family is being given time to grieve and hold the baby before they let go. So making sure that we acknowledge before we enter the room that there's that potential, and making sure that we give them the support and the space that they need so that they have that time to grieve. If you notice it outside of the women's services area, it means that our patient has passed. There may be people in the room with the patient, again, going through the grieving process, preparing the body to be sent to the nursing home, but just be mindful that if there are people in the room or family visiting, that we want to respect their privacy and their space. If you see a purple ribbon on the door in the women's service area or even outside of those areas, it means it's a hysterectomy patient. The purple ribbon symbol is placed on the outside of the door for women who are going or have undergone a hysterectomy, and this may be a grieving process for them. They may have not ever had the opportunity to have children, or maybe they did have children, but they weren't ready to undergo this hysterectomy. So we need to remember that this is still a grieving process for them. Again, please don't ask about any babies or any act like it might necessarily be a happy delivery situation, because they could be there and in the process of grieving. A heart and a triangle means that there's been an adoption. So you could actually see this on mother, baby, or labor and delivery, and you could actually see this on the birth parent's door and the adoptive parent's door. So again, just being mindful to stay away from saying congratulations, where's the baby? It can be a very difficult time for the biological parents, and it could also be a very stressful time for the adoptive parents as well. So just being mindful what this symbol means, and giving space and not prodding. And then the medical symbol in the 2 feet is infant in the NICU. So again, they've had a baby, but it could be a very stressful situation. The child's in the NICU, so they require extra attention and support. And so this could be a very sensitive and stressful time for the parents. So over the next few slides, we're going to go over these policies and standards. Absence and illness. So our expectation is that you show up when you're scheduled, with the exception of a family emergency, illness, or etc. You do need to make sure that you know your department's steps for call-in, so that you do call in a timely, appropriate manner. If you are ill, we do want you to stay home, but we need you to notify your direct manager, and again, following your call-in process. If it's for any scheduled absences, please try to give as much notice as possible. For any students, make sure that you also follow whatever the guidelines is for your school, so that you're following those steps along with the call-in process. Accident or illness report. If injured, or you injure someone while on duty, you witness an injury with a patient or a visitor, we must report it. So you would want to report to your immediate supervisor or another staff person in your assigned area. Volunteers would report to the volunteer program manager. And then we also want to call security for any visitor incidents. How to report a concern. So you would go to the home page of the intranet. Under incident reporting, you would click incident report, and that would allow you to fill out the incident by filling out the electronic form. If you did have a concern, you have several options. You can call the compliance hotline. Confidential never results in retaliation, retribution. It's available 24 hours a day, 7 days a week. You can leave your name if you feel comfortable and give as much information as possible, the observation, incident, suspicion, where, when, and who. And that number is 1-877-547-2633, or you can find it on the homepage of the intranet. Our policy manager works like an electronic search engine with all of the policies throughout our system. Again, you would go to the homepage of the intranet, and that gold bar across the top under policies, you're going to click on that downward arrow next to it, and at the very bottom, you're going to see policy manager. When you click on that, it's going to open a search browser for you to be able to search for different policies throughout our organization. Our dress code. A badge must be worn above the waist. We don't want to utilize lanyards. Lanyards could allow for, in an escalating situation with a disgruntled patient or visitor, could allow for that to be a choking hazard. So we always wear our badges on clips, and we make sure that we wear them high up on our shirt. Closed-toed shoes are required in all patient care areas. Scrubs, uniforms, or business casual are required by department and position. And then business casual does exclude t-shirts, jeans, shorts, leggings, backless, strapless, or spaghetti strap tops, low necklines, sweatshirts or hoodies, bare midriffs, Spanx, and any sheer attire. Hair must be of natural color, short, or pulled back and up. Mustaches and beards must be in natural color, clean, and trimmed short. Fingernails must be clean and trimmed to 1/4 of an inch. Shellac, gel, or acrylic nails are not to be worn in patient care areas. Jewelry worn should be minimal, and Tattoos, all facial tattoos must be covered. Perfume, body sprays, and strong aftershave should never be worn. Smoke and pet odors may also affect others. Personal hygiene is of utmost importance. Body piercings, only ear-pierced jewelry is allowed, and you are responsible to check for and follow department-specific directives in addition to these. Drugs and alcohol, we have zero tolerance in our facility. Use, possession of, selling, or distribution of, under the influence of, and similar, will result in immediate dismissal and the possibility of legal or criminal consequences. Electronics, we need to be mindful that we are at work and be professional, be available in public places, no texting, answering cell phones, listening to music, display of earpods, or internet usage while on duty. We do understand that emergency situations may happen, but we do ask that you step into a non-patient care area away from view from visitors or patients to make those calls. Parking, we have no fee for parking at any of our OLG facilities. We do ask that you display parking tags in the vehicle if provided, and you can check with security if you need to get a new parking tag. Respect all reserved parking signs. So if you see a sign in front of your car that says it's reserved for a specific individual or for someone on call or for chief of different departments, please make sure that you move your car and park in a different unidentified spot. Park in employee designated areas of parking garages and park in lots. When you're parking in lots, park near the street away from the main entrance. So the further away you park, the better. That allows for our patients and visitors to have closer access. Personal belongings. Please be cautious regarding personal belongings. Bring only what is absolutely necessary. Most of our departments do have limited or no secure spaces or lockers available to store valuables. So we don't want you to be at risk of losing anything. And we do ask that you report any missing property to the security department. Clocking in and out. For our contract employees, please locate the time clock where you are expected to clock in and out for each shift. Students, please follow the procedure established between your instructor and your assigned clinical rotation department. And volunteers, locate and use a time clock most conveniently located near the area of your assignment. Accurate hours are needed for compensation, recognition, and monthly reporting. For smoking, every campus within our OLG system is a tobacco smoke-free campus, and this also includes e-cigarettes. We don't have any designated smoking areas since we are a smoke-free campus, and smoking is not permitted anywhere on the property, inside or out. Our complaint process may be written or verbal regarding care received or service provided, and complaints from a patient or his or her designee initially are referred to either the nurse manager, the department supervisor or director of the unit, or the department where the complaint originated. Corporate compliance. Ensure that the organization is working within established guidelines of federal laws and regulations. You have the responsibility to report suspected illegal or non-compliant activities to your supervisor or manager. Examples of reportable incidents are breach of patient confidentiality, inaccurate record keeping, inappropriate billing practice, or research fraud. Discontinued service or dismissal, failure to comply with the hospital rules or regulations, a no-call, no-show, or disregard of the service standards of behavior could result in your dismissal. Patient experience, identifying suspected abuse or neglect. Sexual assault, healthcare workers must act sensitively and quickly for successful collection of evidence if a victim has been sexually assaulted. The victim should not be left alone. Child abuse, physicians, nurses, social workers, and other designated hospital personnel are mandated to report by law. Students or other affiliated personnel should report objective data to the nurse manager or the charge nurse. Domestic violence, hospitals are required to assess patients and clients for the possibility of victimization. Policies exist to respond appropriately when victimization has occurred. Elder abuse, Suspected abuse or neglect should be reported to the charge nurse or nurse manager. Patient Bill of Rights. The patients have a right to confidential treatment, active participation in care decisions, and considerate and respectful care. Hospitals have a responsibility to post a Bill of Rights in all patient care areas, fully explain rights to the patients, assure patients can demonstrate understanding, and assure and document patients' comprehension of these rights. And just another quick review of our AIDIT, which we spoke about under our service standards. A stands for acknowledge, I for introduction, D for duration and time expectation, E for explanation, and T for thank you. Again, acknowledgement, eye contact, smile, stop what you are doing so that the customers know that they feel that they are important to you. Introduction or welcome. Welcome them, state who you are and your position, state your role in the patient's, family member, or visitor's care. Duration or your time expectation. Describe how long the task, visit, escort, transport, delivery, errand, etc. will take, and share how long a patient, family member, and/or visitor may need to wait before receiving the requested information, service, follow-up, response, return visit, wheelchair transport, etc. Explanation, offered to answer any questions or concerns or resolve any complaints that you can resolve or refer to others as appropriate. And then thank you, which is wishing you well. Say something to convey your appreciation. Thank you for letting us serve you. I hope that you continue to recover and heal well. I hope that you received very good care while you were here and that you feel better soon. Thank you for attention to this presentation this morning. Auctioner Lafayette General, we appreciate the time and service that you will offer to our patients, our visitors, and staff. Thank you for joining our journey to excellence and our commitment to making our health system a great place for employees to work, students to gain knowledge and experience, volunteers to give back to their community, patients to receive care, and physicians to practice medicine. We're excited to have you as part of our team and look forward to meeting you. Thank you.